How does neuroplasticity heal the stroke brain? How does neuroplasticity heal the stroke brain? This fascinating process allows the brain to adapt and reorganize itself after a stroke. When a stroke occurs, it damages specific areas of the brain. Neuroplasticity enables the undamaged parts to take over the lost functions. This happens by forming new neural connections and pathways. It is important to note that this does not restore the original damaged neurons but, instead, creates a compensatory rewiring that helps recover abilities like movement, speech, and thinking. After a stroke, neurons in the area surrounding the injury can reorganize. This area is known as the penumbra or peri-infarct region. These neurons can grow new connections, allowing healthy neurons to receive signals and compensate for the damaged areas. This process facilitates functional recovery. However, spontaneous neuroplastic changes alone are often not enough for significant recovery. This is where active rehabilitation therapies come into play, promoting and enhancing neuroplasticity. Neuroplasticity works through two main mechanisms. The first is functional neuroplasticity, where the brain shifts functions from damaged regions to undamaged areas. This allows other parts of the brain to perform tasks that were lost. The second is structural neuroplasticity, which involves physical changes in the brain. This includes forming new neurons and neural pathways to replace or bypass the damaged ones. Rehabilitation therapies are designed to leverage neuroplasticity. They encourage repetition and task-specific practice, which strengthens new neural pathways. For instance, practicing hand movements after a stroke helps the brain reinforce or create new connections that control that hand. Emotional motivation and engagement also play a significant role in enhancing the brain's adaptability. Timing is crucial when it comes to rehabilitation. Neuroplasticity is most active shortly after a stroke, particularly within the first 6 months. This period is often referred to as spontaneous recovery. Early and consistent therapy maximizes the brain's ability to rewire itself and regain lost functions. Techniques such as physical therapy exercises, repetitive task practice, and brain-stimulating activities help recruit new neural circuits to improve strength, mobility, and other skills. Neuroplasticity is also experience and learning dependent. This means that the brain's rewiring improves with targeted rehabilitation and practice. Stroke rehabilitation based on neuroscience aims to facilitate adaptive learning, shaping neuroplasticity toward positive functional outcomes. However, without appropriate intervention, maladaptive plasticity can occur. This can lead to poor recovery or compensatory behaviors that limit function. In summary, neuroplasticity heals the stroke brain by enabling undamaged areas to reorganize and form new connections. Rehabilitation therapies are essential to harness and guide this natural brain adaptability. This promotes recovery and improves the quality of life after a stroke. Always consult healthcare professionals for personalized advice and treatment options.